Great. Thanks for being here today. My name is Lucy Skinner. I am a third year family medicine resident here in the Full Circle Boise program. This talk is a little different than the usual, more clinically focused talks. This is more focused on health policy and um, kind of the some big changes that are coming our way and how we can, as clinicians, be prepared and um, continue to take care of our patients. All right, we'll just get started here. Here's my accreditation statement, and I have no financial relationships to disclose. And I also wanted to put in a political disclosure here that this presentation is not intended to support any particular political view, candidate, or a specific policy. This is really supposed to focus on the research side and implications of specific policies and not provide any sort of judgment or feelings about those policies. So today our learning objectives, we'll start with a broad overview of the 2025 Budget Reconciliation Act. This is also known as One Big Beautiful Bill that passed in July of 2025. And then we'll focus more on the national scale as that's also important to us here in Idaho. But we'll understand how the Budget Reconciliation Act impacts Medicaid and Medicare, as well as the Affordable Care Act on the national scale. And then we'll review the implications of these changes on healthcare outcomes on the national scale as well, and understand how these changes will specifically impact rural and underserved populations. And then we'll focus in on Idaho here, and we'll take a look at how Medicaid coverage will impact healthcare access here in our state of Idaho. And then we'll learn a little bit about the Healthcare Transformation Act, which is part of this bill, and what that means for our state. And then we'll kind of wrap up by thinking about why we should care about this and what we can do. So with that, we'll get started. So the 2025 Budget Reconciliation Act, I'm not going to get into the nitty-gritty because it's a very, very big, complicated bill, but essentially the places where you can see on this graph, the orange are things where money is going towards, essentially moving away from the things in blue, moving towards the things in orange. So tax cut extensions and other tax provisions, temporary tax cuts, and defense, homeland security. So those are the direction that spending is moving towards or saving money from. And then the places where we're cutting from our federal budget are Medicaid, green energy and environment, student loans, food benefits, and then other healthcare provisions and natural resources. So that's kind of a very general overview. We're going to focus mainly on the healthcare related side of the budget. So on a federal scale, big picture impacts on Medicaid. First is work requirements. So this means that childless adults and parents of children who are older than age 13 have to work, volunteer, or attend school for at least 80 hours a month as a condition of their enrollment in Medicaid. And well, most people, probably 90% estimated enrollees already meet this qualification. The big change is that they will have to do twice annually, they will have twice yearly eligibility evaluations where everyone with Medicaid will have to recertify their work or volunteer or schooling in order to keep their Medicaid benefits. So the administrative burden of the work requirements will be significant. The bill also eliminates Medicaid expansion funding and incentives, so it eliminates the incentives that were previously present for states to expand Medicaid, or new states who have just recently expanded Medicaid, they'll lose that financial benefit. It reduces overall Medicaid reimbursement. So um, the plan is to have state-directed payments at 100% of Medicare reimbursements in expansion states, and then 110% of Medicare reimbursement rate in non-expansion states. There will be a requirement for co-pays and cost sharing. So uh, individuals with Medicaid will be required to have a $35 copay for their medical care. And that I think will be a little bit state dependent, but in the federal bill, it's outlined that anyone who is making over 100% of the federal poverty level will be required to have a copay. Um, it will also reduce eligibility for individuals who are recently immigrated or green card applicants who are awaiting. They have to go through like a 5-year waiting period for eligibility, and then it also limits emergency payments for those who are here without legal status. So right now, if someone without legal status gets emergency medical care, Medicaid will pick up some of that cost of care, but that will be severely limited in the new bill. The bill cancels minimum staffing regulations for nursing homes, and also prohibits the use of any public funds for gender affirming care or any payments to Planned Parenthood, which include kind of their um, uh, STI treatment care, their cancer screening care. So here is a map of the United States, and this gives a sense of how much of the federal Medicaid budget will be cut in each state. So you can see here in Idaho, we're in that 7 to 10% cut, but it ranges depending on which state you're in. And what are the implications of these changes? So a big thing is that Medicaid won't be giving as much money to physicians and hospitals, about 14% reduction. And rural hospitals, specifically, who rely heavily on Medicaid, are projected to lose $137 billion over 10 years from these cuts. This is going to put many hospitals at risk. The estimates vary, but up to about over 300 hospitals are at risk of immediate closure with this loss in funding, as well as 432 that are vulnerable to closure. This is at the national level. There's going to be a significant reduction in long-term care and community-based programs that previously received federal funding or Medicaid funding, and a significant increase in mortality and preventable hospitalizations. Here's a chart from a paper that was in JAMA. They took the proposed budget changes and kind of projected out the healthcare outcomes that they predicted would come from these changes in coverage. So at the top, you can kind of see there's like a base case of how many people would lose coverage and a higher coverage case loss. So at the top of the table, you can see kind of the base case of Medicaid state programs and their loss in coverage. And then here we can see that the number of excess deaths is predicted, as well as the number of preventable hospitalizations. And as a reminder, this is, well, yes, we're cutting Medicaid funding. These hospitalizations that were preventable, those will have to be paid for. So the cost of people due to the number of people delaying care due to costs because they no longer have insurance is estimated to be between 1.6 and 2.5 million. And then medication non-adherence due to cost is similar, 1.9 to 2.9 million. This is then projected out into the economic impacts of jobs lost. So 300 to 400,000 jobs lost, a huge reduction in GDP, um, as well as medical debt. And like I mentioned before, yes, we're cutting the Medicaid budget, but we know that that has downstream impacts on the number of preventable hospitalizations, which are very expensive. And then at the bottom here, you can see this is a more conservative estimate of these are the number of rural hospitals that are at very high risk of closure. So with these changes, they anticipate over 100 hospitals at high risk of closure, and those estimates go up to about 300 hospitals with different studies. And a reduction in revenue at FQHCs of 18 to 26%. And we'll talk about that more later in the talk. Here's a little comedic relief. And on to Medicare and the ACA. So what's going to happen to Medicare and the Affordable Care Act? Medicare, so the bill does increase Medicare physician reimbursement by 2.26%. And you might think that this sounds good, but this does not take into account inflation or budget sequestration and neutrality provisions. And to give some perspective, since 2001, inflation adjusted Medicare reimbursements have decreased by 33%. So essentially, we have not seen much of any increase in Medicare reimbursement based on the inflation rate. Medicare Advantage reimbursements will increase by 4.3%. And just as a reminder, Medicare Advantage is where the federal government pays private entities um, to manage um, hospital, medical, and prescription drug coverage all under a single plan. But these are private companies that then manage that money, so they have discretion about how they kind of pay for different things within those plans. And then the Affordable Care Act. So right now, or previously, there was a tax credit for people who enrolled in insurance through the Affordable Care Act, and that will go away. It's estimated that out-of-pocket premiums will increase by over 75%, and that 4.2 million people will lose coverage on the exchange. So here are a couple graphs. So here, this is not adjusted for inflation, but just kind of shows the flat fee. So you can see here, this is what Medicare is paying to physicians at the bottom, physician reimbursement. And then you can see the rise in the consumer price index as well as practice costs. And then these are the reimbursements that they're making to hospitals in skilled nursing facilities. And then the next, this is adjusted for inflation here. So you can see the Medicare conversion factor that the actual is in blue. So that's been flat and declining over the past, let's see, since 2000. And then if we were to adjust the conversion factor for inflation, it would be the orange line. So we're not keeping up there. And then this is a graph from the Kaiser Family Foundation that was published in the New York Times that shows that for individuals in each age category who make $65,000 a year, this is how much their monthly premium for insurance bought through the Affordable Care Act will increase. So as you can see, especially for those age 60, in a lot of areas, premiums are going to increase by more than $1,000 a month. So you can see why many people will not be able to afford their health insurance on the exchange. And even for those age 26, premium increases of $300 to $700 a month would be a huge burden for their total their budget based on their earnings. So how will this impact rural communities? And looking more on the national scale here. So rural hospitals are projected to lose about $137 billion over 10 years. That's a lot of money. There is a provision in the uh, Budget Reconciliation Act called the Rural Health Transformation Act. This sets aside $50 billion for rural health. Um, Essentially, we'll talk more about it, specifically about how it pertains to Idaho, but um, states have to apply for the money, and then the federal government allocates a certain amount of money from that 50 billion to each state, and then the states decide what they want to do with the money. So 2 million rural residents are projected to lose Medicaid coverage. This will disproportionately impact maternity, especially maternity care in rural hospitals. Medicaid is the primary payer for obstetric and maternity care in rural hospitals, so cutting funding will really strain these maternity units that are already operating on very slim margins. This reduction in reimbursement impacts rural workforce recruitment and retention. It impacts abilities for rural hospitals to offer loan repayment plans or competitive salaries. There's also a limit on federal student loans, which impacts loan repayment and makes it harder for grads to pay back their loans if they're working if in rural places that aren't able to support loan repayment. And provider shortages overall, because of these changes, are projected to increase. We know that when rural hospitals close, they are one of the primary employers for rural communities. So when rural hospitals close, we see increased unemployment. That leads to a decrease in the tax base and then decrease in social services for these communities, such as emergency medical services, school funding, infrastructure, roads, parks, things like that, that make these communities vibrant places to live. And then there are many studies that have shown that when rural hospitals close, mortality rates and unemployment increase. So everyone suffers when the hospital closes. Here is a map. This is the kind of bigger estimate of rural hospitals at immediate risk of closing. So you can see in Idaho, we are in the 1 to 10 range of rural hospitals, but it's varied throughout the country. And now we'll take a look at FQHCs. So this is the national perspective of kind of how FQHCs will be impacted, but we'll look a little bit more closely at Idaho and how we might be impacted here. So as a reminder, FQHCs serve all patients regardless of their ability to pay and rely very heavily on Medicaid. Um, and get an additional kind of kickback for treating Medicaid patients, which helps them keep their doors open to care for everybody who needs care. So, on a national scale, an anticipated 5.6 million FQHC patients will lose Medicaid coverage. So, if FQHC patients lose Medicaid coverage, they become uninsured, and therefore, the right now FQHCs will treat everyone and cover those costs of uncompensated care through different kind of state or federal grants, but it having a larger burden of individuals without insurance would place a financial burden onto FQHCs. So different with these changes, there are restrictions on the services that FQHCs are able to provide. For example, gender affirming care, especially we for those who have public insurance. And in order to continue to receive funding, they have to abide by certain restrictions. And then, similar to rural hospitals, FQHCs also face workforce constraints with decreased reimbursement. They have decreased funding available to recruit providers, And with the limited federal student loans, it makes loan repayment programs harder. If graduates have private loans, it's much harder to work with loan repayment programs. Additionally, when states redirect their Medicaid and SNAP funding, um, or when the federal government redirects Medicaid and SNAP funding, the states, if they want to continue those programs, often are forced to reallocate funds, and that can take money away from FQHCs. And as we saw above in that table, FQHCs are projected to lose 18 to 26% in revenue, and that is a huge amount of their operating budget. So it's anticipated that many FQHCs will struggle after these changes kind of ramp up. All right, let's narrow in and focus on our home here in Idaho. There's a lot going on here in Idaho, and a lot is very new and timely. So I tried to keep this as up to date. But Medicaid cuts are a big conversation in our state right now. We did expand Medicaid in 2018. That was a vote, and more than 60% of Idaho voters ex voted to expand Medicaid. Um, and now we're trying to figure out what to do next, especially with a recent finding that our budget needs a little help. So this is the bottom article is actually from 2 days ago, and the governor is trying to find money to fix our budget. So it sounds we'll learn a little bit more about that here, but as you can see, this is a very, very important topic in our state. So Idaho's in a little bit of trouble here. We had a pretty good managing our budget, but now we are in a $4 billion deficit. And the state will need to come up with an additional 600 million to $1 billion to fund the budget in 2027. So right now they have a lot of areas that the governor is wanting to cut funding from, and Medicaid is one of those areas. So here is what Idaho wants to do with Medicaid, and this is from that article 2 days ago, so hopefully it's up to date. But the from the federal budget side, so the Medicaid gets federal budget money as well as state money. So here in Idaho, the federal budget is cutting $4.3 billion from Idaho Medicaid funding. And that is projected that almost 100,000 people will lose their coverage from both the budget cuts and work requirements. So that's kind of impacts from the federal side. And then most recently, Idaho, in order to save money, will is planning to decrease Medicaid provider pay rates by 4%. So this will save the state $45 million, but as we discussed, Medicaid is a significant payer for many of our rural hospitals, our FQHCs, our hospitals in Boise, and those cuts are going to represent a significant portion of their revenue. And then the governor's planning to further reduce Medicaid services to save another 22 million. It's unclear exactly what services are going to be further reduced, but we can stay tuned on that. And then Idaho's planning to shift Medicaid benefit management to private companies, which is like managed care. This is a little bit confusing. So essentially right now, the uh, right now we have a quality or previously the Medicaid was managed through provider offices, and we were reimbursed based on quality and outcome metrics. Um, and that is what dictated the amount of money that providers would get for caring for their Medicaid patients. This proposed shift is it's managed care in that the state will pay a capitated fixed price per beneficiary of Medicaid. So essentially, for each person on Medicaid, the state will pay a fixed price to a private company, and they've chosen to have three different companies be a part of their Medicaid managed care so they can promote competition. And then the private company manages the payment to the provider. And so they're incentivized to save money because they only get a fixed payment per beneficiary. So it's a little bit confusing, but that is that shift to private management of Medicaid benefits is intended to save the state money overall. They'll also implement cost sharing and co-pays like we talked about earlier. So that's that kind of required payment for medical care for Medicaid beneficiaries. And it's to be determined kind of who and at what level that will go into place for different individuals. And this is ongoing. So this is kind of hot off the press new stuff. This budget deficit kind of just was recently discovered, so they are trying to figure out how to move forward. And so I think we'll hear more about the plans there. There's some pressure to um, get rid of Medicaid expansion in the state, but it does look like the governor is in support of Medicaid expansion with a lot of these restrictions and Medicaid cuts. So we will see what happens. Here is a map of the percentage of individuals who are covered by Medicaid and CHIP in our state. As you can see, um, even in the counties with the least coverage, we still have at least 16% coverage. So Medicaid is very important in coverage for our state. And here are our critical access hospitals in Idaho. And on the left, it shows the individual hospitals as well as their vulnerability scale. So this is dependent on the um, the population that the hospital serves and how many of those households are living in poverty, how many are living without a vehicle, without health insurance, with mobility challenges, and households without English speakers. So that is kind of the overall vulnerability of the population. And then you can also see on the other side, they have providers per 10,000 residents. And some of our hospitals, that number is quite low, less than two providers per 10,000 residents. So because it's hard to read, I just wanted to point out the hospital areas that are at the most vulnerable, and that's Weiser Memorial Hospital, you can see on the left, and then Syringa Hospital and St. Mary's, they're kind of in the middle here, and then Boundary Community Hospital, that's up north. So those hospitals are serve a very vulnerable population, and thus are very vulnerable as well to these budget changes. Okay, so let's focus in on how these changes impact rural and underserved populations here in Idaho. And we kind of saw a little bit on the map of where those um, uh, the most vulnerable areas and the hospitals that serve the most vulnerable areas. But looking a little more broadly, we know that the loss of Medicaid coverage is from our most financially vulnerable populations who often face many other social determinants of health. And so the loss of healthcare coverage is very detrimental to these vulnerable populations. We also know that with work requirements and twice annually recertification of work, that this is a huge administrative burden. And it will disproportionately impact non-English speakers, newly arrived Americans, individuals with low financial or medical literacy or any lower education, because I honestly don't even know if I could navigate the certification process because it is very complex. And to have to do that twice a year is a huge burden for our patients. And we know we have a lot of rural hospitals here in Idaho, and they are vulnerable to closure. And this will impact the mortality and unemployment in our state. And that will then impact all of us as well as people who live in this state. Um, the Medicaid and ACA cuts significantly impact Native Americans who access healthcare outside of Indian Health Services. So many Native Americans have access to IHS, but there are very a large population that um, access healthcare through Medicaid or the ACA, and they will also be impacted by these cuts. And we know that both federal and state budget cuts will impact children through reduction of SNAP benefits, which is a big cut in the federal budget, Medicaid, as we discussed, and a decreased funding for public schools, which is an area that with the Idaho budget, there's a proposed a big decrease in public school budget for 2027. We also know that young adults are actually very vulnerable during the transition from being children to adults in Medicaid enrollment. That's a huge time, ages like 18 through 21, when young adults lose healthcare coverage. And so having a more restrictive process will increase that um, loss of um, individuals with Medicaid. This will affect our patients who access gender-affirming care, as well as any services provided by certain reproductive health centers, including all the services at Planned Parenthood. And we know that this will have a disproportionate impact on maternity and neonatal care, especially in rural areas, and it can cause closures. We've already seen many closures of maternity units, even in the Treasure Valley. And that will continue to happen if they aren't able to get adequate funding. Okay, well, hopefully this is like the good, maybe a little bit good part where we talk about the Rural Health Transformation Fund. So, like I mentioned earlier, this is $50 billion written into the budget that is available for all 50 states. So, the way it worked is that each state individually had to apply for this funding with a grant to the federal government, and then they were allocated a certain amount of money. And then that money then goes to the state, and the state decides how they are going to spend the money. So in Idaho, we got $930 million. This is spread out across 5 years for our to improve rural health care access. So that is a good thing. And how are we going to use it? Let's review. So this is based on the grant proposal for this money from Idaho. So it hasn't happened yet, but this is what the money is intended to be used for. So it'll be $186 million each year for 5 years. And they propose to address kind of four big areas. One is to improve technology as a way to improve healthcare access in rural areas. And that there's a couple ways they're doing that. One is mobile apps and portals that allow patients to self-monitor, schedule appointments, um, access coaching, I guess like health coaching. They want to increase the number of facilities using telehealth by 50%. Um, and create this new health alert network. So this is like essentially, um, it's basically like if there's a health problem or concern, the EMS or there's a danger in the community, there'll be like a text alert that goes out to all the providers and schools and EMS, and everyone in the community will be notified about this through this health alert network. And then there's a plan to deploy these like kiosks and pods in rural areas, in libraries and schools and other public community centers where people can go to the kiosk and then attend a telehealth appointment. And that would allow access for those who don't have computers or phones, that they could still access telehealth care. They also want to address workforce shortages, which is great. And that was it was interesting. A big emphasis on expanding the use of non-doctor professionals, specifically emergency EMS and first responders. And so it um, create proposes to create a community health emergency services plan that essentially target recruits a bunch of EMS professionals into rural communities, trains them, has money for retention, and then they are trained to go to community members' houses and perform assessments and like do little check-ins and kind of medical visits. They also are proposing to increase the clinical rotations in Idaho for medical students to help medical students have exposure to rural Idaho and develop relationships and then hopefully return to those rural sites. And then there are also financial incentives and scholarships for doctors who commit to work in rural Idaho for 5 years. So that's embedded into this um, money that the grant that is proposed to use this money for. A couple other places that this grant is going to focus on the Make Rural America Healthy initiative. So this is focused on treatment of chronic disease. They propose to implement the National Diabetes Prevention Program, which is helps to delay diagnosis of delay onset of diabetes and education about healthy eating, specifically type 2 diabetes, um, healthy eating and exercise programs, enhanced chronic condition screening and education. And that was specifically focused on Alzheimer's and dementia, cancer, heart disease, and like hypertension and those things. Um, Proposed pediatric psychiatry assess line, which is basically a line pediatricians and providers could have direct access to pediatric psychiatry through a telehealth or a phone to help care for children. And they also propose mental health treatments in schools. Also, mobile crisis response teams and mobile medication assisted treatment. And then needs assessment for maternal and neonatal care. And the goal for this Make Rural America Healthy initiative was to decrease deaths by suicide, drug overdose, and alcoholism by 25% by 2030. And then they started this new perinatal collaboratives initiative and the goal would be to recruit 8 hospitals to participate in this. So that was outlined in the Idaho's plan. And then some infrastructure investments, modernizing healthcare facilities, purchasing CTs, MRIs, and equipment to compound pharmaceuticals, mobile mammography units, and then within this bill, 3.5% of the funds are set aside for tribal health services. So that will be allocated every year, 3.5%. Okay, so why should we care about all of these changes as clinicians in Idaho? Um, Why is this important? Well, a big thing is that our patients are going to lose healthcare coverage. Many of them, a lot of our patients rely on Medicaid or the exchange, and they'll lose their coverage. Um, and we know that when patients lose coverage, that doesn't mean they never access health care again, especially those who are often facing many social determinants and are chronically ill. They will just delay the care and they end up in the hospital, in the ER, and the cost of their care is absorbed either by the hospital or hospitals that then close or they're bailed out by the government. And really, that burden falls on all of us to care for our community. And also, when hospitals close, we all suffer, and we know that as both as providers and consumers of healthcare. We know that our healthcare outcomes are worse when rural hospitals close. Um, that And we have a lot of rural hospitals and a lot of rural state here, so that's very important for us in Idaho. And we know that our economy suffers when rural hospitals close. People lose their jobs. Um, Taxes, they lose tax base. Public infrastructure is not paid for, parks and schools, and people move away if they don't have parks and schools and jobs. So the rural communities as a whole um, tend to do much worse after losing their hospital. And our FQHCs and public safety net services are very vulnerable and at risk of closure with these changes. And here in Idaho, we rely a lot on our FQHCs. They're really important for caring for our community here in Boise. Um, we train our residents at an FQHC, and when we struggle financially, that can be impacted. And these are, residents who often go and practice in rural Idaho, so the trickle down effect is significant. And then um, the the impact of losing a safety net healthcare system um, puts a burden on other providers as well. We know that these changes impact our most vulnerable populations and will continue to disproportionately impact those individuals. And our reimbursement is impacted by budget cuts, Medicare and Medicaid reimbursement, and that impacts our ability to recruit physicians into rural and underserved areas. Um, our pay, our loan repayment, those kinds of incentives can be um, really significantly impacted when overall revenue is reduced. And we are already at the bottom of the nation for per capita physicians. So we need to care about this a lot here in Idaho because it could get worse. Um, and our shortages that we're already facing and are very challenging for our residents, that could become a bigger problem. Okay, well, not to end on a depressing note, but what can we do? The biggest thing is that we keep taking care of our patients and providing good health care and staying informed about the changes that are coming. Here, the Idaho Academy of Family Physicians has been a strong advocate for um, Medicaid expansion, access to healthcare for our patients, recruiting family physicians, um, especially in rural and underserved areas. So that's a great resource to get involved with. You can reach out to your legislature and tell them what's important to you, and what your things you're worried about, and hopefully we can have our voices heard. Idaho Voices for Children is a great organization that advocates for Idaho children, and supports vulnerable populations. And then Idaho Supports Medicaid. It's a really good organization, um, or website even, because they have a ton of resources just about learning about these changes. And so even you can join and be a part of it, or just learning about kind of different um, proposed changes to Medicaid, how you can be involved, what we can do to try to be a voice for our patients. Um, yeah, and then keep on doing good work and encouraging people to come to the state. Okay, well, thank you all for listening. Um, I know this was a different kind of talk, but hopefully you took something from it. And I think staying tuned and seeing what other big changes are coming. There's a lot that is happening right now in our state. So, um, yeah, read your local newspaper and um, stay updated. I tried to make this as updated as possible, but there's always changes happening. So, okay, here are my references. I can go back to them. If anyone has questions, I will now open it up.
I have hi Lucy.
Hi.
This this is Winslow at Full Circle Health. I was curious for you, having kind of done the research over the last year, digging into this, and then getting up to date, going into the legislative session. What is kind of most on your mind, and what are you going to be most interested to kind of track in the current legislative or in the coming legislative session?
Yeah, that's a great question. I think that the budget issue is definitely a big problem for the state, and there's a lot of areas that are going to get cut, including um, highway and schools and environmental regulations and um, Medicaid is definitely a big one, but there'll be a lot of areas. And I think even with significant cuts, it's going to be difficult to balance the budget. So I'm interested to see where they land on Medicaid. I do feel like Governor Little is overall sees the importance of Medicaid expansion and is kind of protective of that, but I will be interested to see how they shave off money from the budget to meet that deficit overall and how I think it's one thing to like read these things and think about um, what are the proposed changes or what is enacted, but then to feel it on the ground of like seeing patients who have lost their Medicaid. I feel like I haven't quite seen that clinically yet, so it will be interesting when the changes catch up with our clinical care to see kind of yeah, what that feels like as well. So, yeah.
Awesome. Yeah. Thank you. That was a great talk. And I do love hearing the kind of frontline clinician perspective on these things. And having started here pre Medicaid expansion and seen the changes, it'll be interesting to see how um, the effects and different contractions are uh, impact us in our work here. Thank you.
Mhm.
Lucy, this is Justin. Thanks for the talk. I really appreciate
Mhm.
that overview. Were you able to talk to Ted or financial people specifically at Full Circle Health about the thought of a 18 to 26% budget decrease? Is that an average? Is that really a local thing? Do you have any sense about kind of the very
Yeah.
local approach to something like that?
I wish I had kind of tried to schedule a time to talk with Ted. I think I was a little, last minute putting these things together, especially with the new big budget changes that came out. But I would be really interested. I feel like kind of anecdotally learning from people who've worked at Full Circle for a while, it feels like the budget has tightened a lot and margins are much thinner than they used to be. So I wonder if that is just going to continue to accentuate with these changes. And I know that we um, care for a lot of Medicaid patients, and uh, that it would be hard if 14% of those patients lost coverage and became uh, uninsured. That would be a big loss of revenue, and we would still care for them and somehow have to kind of figure out how to pay for it. So yeah, I would be interested to talk to Ted Epperly about kind of what he sees as the yeah, what he's worried about.
Dr. Skinner, someone in the chat asked a question. Chris says, can you speak a bit about impacts to public health districts in the state?
That is a great question. I don't know specifics, but I do think that um that public health district funding is likely going to be one of the things that is negotiated in this bill, and I wouldn't be or in the budget balancing, and I wouldn't be surprised if that funding is further limited. So, but I don't know for sure. I think that's probably something that is still under negotiation, kind of moving forward.